Hi, I'm Dr. Maggs. Today we're going to talk about a topic that is something we hear about probably every day. We have a lot of young middle school, high school students coming into our office, and we know that the phrase tech neck has been thrown out there, and uh, people kind of associate tech neck with some young kid looking down at his phone, and we try to quantify what bad that is going to have on that young kid's life. But there's truthfully so much that's not known by society, and I'm going to go over a few of the basics. Do iPhones really cause tech neck? Well, what is tech neck? First of all, it's the head forward flexed. That can cause strain and lead to neck issues down the road, whether they be muscular issues or pinched nerves or disc issues or accelerated arthritis, whatever it is. It's a position that is not optimal. And when it's done, any position done repetitively is going to have its consequences at some point in time. But here's where the problem comes in. The assumption is that everybody has a normal neck at birth. And now we say, okay, what's a normal neck? Well, the one on the left, you can see we have here is the throat of the patient. We have a forward curve, and they call that a lordotic curve. So it's something like this. Let me see if I can get that there. There you go. It's a forward curve, and the head is approximately 10% of the body weight. So what happens is that forward curve, the lordotic curve, provides good shock absorption. Okay. The black spaces between the white bones are the discs. You can't see the discs, you can see disc spaces. And then that pencil mark coming down through the center of the spine, that is the center of gravity of the head. So simply put, if you ask any engineer, yeah, you want every bone in that neck to support and contribute to the support of the head. And over time, that neck is going to do pretty good. So, from an engineering perspective, it's pretty good. Now, to the right is an open mouth view. This doesn't play into tech neck as much, so I'm not going to go through the details the same, but that's a normal open mouth view. So that forward curve, center of gravity going through every bone, plump disc spaces, that's what we want. And if you have anything other than that, then from an engineering perspective, the neck is going to be under a compromised state on a daily basis. So now let's go to our next slide and see what we have. We do a structural fingerprint exam, and I've done that for the past 30 years. And with the structural fingerprint exam, we take those two x-rays on virtually every patient who comes in, even if they're asymptomatic, because I'm not looking at what's causing your pain. I'm looking at what does your architecture look like and what is the prediction for the future on any imbalances that you have that will accelerate breakdown and that will increase the vulnerability of injury. So that's what I'm looking at primarily. So we take those x-rays. So I have literally thousands and thousands of side view neck x-rays that we've taken over probably the last 40 years. But so we've looked at so many. And what would be shocking to society is that that's not the neck that we see, because here is a picture of what we call actuary Alex, and actuary Alex is what the name suggests. The imbalances that every human has is going to cost that human through their lifetime. And the sooner they look into how do I reduce the cost, what do I proactively have to do, the sooner you do that, the better your life will be and the less you will spend on the biomechanical imbalances that exist. So we encourage at the age of 7 to get orthotics and get the one x-ray to see if your hips are level. If they're not, then we put a lift on to level the hips as much as possible. And then the following year, 2 years, we take that x-ray again. And then at the age of 12, we do our full biomechanical exam. Structural fingerprint exam we do starting at the age of 12 because it involves 2 x-rays of the low back and 2 x-rays of the neck. So we know that every human is actuary Alex. And our society is set up to not be concerned about those issues until you hurt, until you have symptoms. And that's what we get. We got people calling the office, coming in because their back hurts, their neck hurts, their shoulder hurts. And with that approach, it's going to cost a lot more than if you were to proactively address these. However, when it comes to the neck, this is four X-rays, typical X-rays, pulled out of the middle of the pile, not the best or the worst. This is the middle. And you can see the age on each one of them. And you can see that the curve is not there on the second one from the left at the bottom, age 16. You can see it's a reverse curve. And you can see all of them, the center of gravity is forward of where it should be. But that neck doesn't hurt. So therefore, no one's going to look at it. And if you take it to traditional doctors, they're not going to look at the x-rays because A, you don't hurt, and B, they don't know how to read the biomechanics on the x-rays, and C, they don't know what to do with it. Excuse me. So no one is looking at our kids as they should. However, when you have that neck and then you put it into a continually flexed position, do iPhones cause tech neck? No, they aggravate tech neck. They contribute hugely to an already distorted, dysfunctional appearing spine. Now, what happens with this spine when it ages? Now, again, I said you have taken thousands and thousands of x-rays from 12 years old to 85 years old. And I get to look each decade and find out, what does this neck look like each decade? And this is a close-up, just so you have a little closer look at the little reversal in the center there, straight neck. So what that does is the compressions go straight through the spine. There's no absorbing the loading. There's no dispersing the loading. So therefore, the joints are getting a lot more loading and stress on a continuum. And then when you go from this position, neutral, to a tech neck position, now the neck is going further into distortion. So it's it's an aggravation of a already distorted neck. Now let's look at 40 years down the road. And you can see that if you look at the upper vertebrae and the upper discs, they look pretty good. But when you come down here, you can see the degeneration. The upper discs look good. You come down here, you see the degeneration. Upper discs look good, lower degeneration. Same thing here, closed off totally. So now let's take a closer look at that. And we can see that these upper discs look wonderful, but the degeneration here, when the discs degenerate or when they compress, I say that's when chaos begins. You're getting muscle spasm, you're getting inflammation in the joint, you're getting compression of the nerve, compression of the spinal cord, and every and any symptom can occur. And that's what we move on. We move on symptoms, but we're not looking at the destruction that's taking place in our necks. And this is what occurs when your neck is in an abnormal lordotic state, and when you add the hyperflexion on a repetitive basis, then this is what occurs. But the problem is, this generation of 40, 50, 60-year-olds didn't have smartphones back then. So therefore, they weren't in that position as much as kids are today. So the generation today is going to end up with much worse degenerative changes, disc injuries, osteoarthritic injuries, nerve compressions than the older generation that is out there now, because they are aggravating at a much younger age, and nobody knows from a repetitive basis how much can they take before it becomes severe, total disability, the need for pain management. You're on drugs for the rest of your life. You can't work anymore. I mean, it's tragic. We have these patients come in all the time, and it's tragic because nobody taught them. Nobody's telling anybody what I'm telling you. And here's a picture of a disc protrusion. And you can see once that disc starts spilling out, now is it surgery? Now, is it pain for the rest of your life? And again, in our office, we use spinal decompression. It's a beautiful, tremendous therapy combined with laser therapy to help to reduce the swelling and inflammation. It helps to reverse the vacuum and draw that disc material back in. But it may take a lot of decompressions to reverse that. So, in the end, what should we do? Well, it's like women with high heels. We're never going to convince them not to wear high heels. Okay. So, we're never going to convince our kids not to use cell phones and not to look down at them 8 hours a day because they don't hurt now. So they're going to continue. And especially, I just told somebody today, as a parent, if you tell your kid not to do it, he's going to want to he's going to want to do it more. So the best thing that can be done, from my opinion, I've been in this over 45 years, is get a biomechanical exam. Understand where the starting point, where the baseline is, and then proactively, there are things that you can do with exercises, with chiropractic adjustments, with orthotics, with making sure leg lengths are even, with exercises that will help to restore motion or keep motion. Techniques that help to keep muscles clean, because those muscles in the back, when I bend my head forward, they're working all the time. And even in the neutral position, if I have a forward head carriage, those muscles are constantly working. You've got to do proactive before the volcano erupts. And that's why you have to start with the baseline. Where are you at? And what can you do proactively? And we need the help of parents. We need the help of coaches. We need the help of administrators to encourage kids to go through this. And then in that process, maybe raise the education level of why you don't want to look down at your phone continually from a musculoskeletal perspective. So there you have it. That's my opinion on TechNec. I wish you all the best, but we have an issue here that we all have to deal with. So step up, help us out. And if I can be of any help, as always, give us a call.